Makes a huge difference if you'll do me a favor by subscribing and liking the podcast wherever you listen. It goes a long way. Thanks, and I hope you enjoy.
So it was of interest to me to say, well, look, can technology solve some of these very human problems in medicine?
Charlotte Blease is an academic, author, and public speaker. As an academic, she works as a health informaticist with a background in philosophy. She's published more than 160 articles in peer-reviewed journals and books on healthcare. She works as an associate professor at the Participatory eHealth and Health Data Research Group at Uppsala University in Sweden, and a researcher at Digital Psychiatry, Beth Israel Deaconess Medical Center, Harvard Medical School. She's the author of Dr. Bot, Why Doctors Can Fail and How AI Could Save Lives, came out in 2025, and previous co-author of The Nocebo Effect, When Words Make You Sick in 2024. During the past 20 years, she has held research appointments in the departments of philosophy, psychology, cognitive science, and medical humanities in the UK, Ireland, and Germany. She spent 5 years at Harvard Medical's, first as a Fulbright Scholar, a research fellow, and for 3 years as a Keen Scholar. Her research has been profiled in diverse outlets like Time Magazine, the New York Times, CNN, the Daily Mail, the Washington Post, the Guardian. And we talk about her book and her work and the impact that AI could potentially have for the healthcare system, for patients, doctors, and the challenges and the benefits that may come and the challenges that exist. I hope you enjoy this conversation with Charlotte Blease. All right, Charlotte, welcome to the Wisdom of Life.
Thank you for having me.
Yeah, my pleasure. My pleasure. So you've written this book, Dr. Bot, and I wanted to start with what first inspired you to write this book? And was there like a specific case, study, or gap you recognized in healthcare that made you believe like AI needs to play a larger role?
Yeah, it's a great starting question. Basically, I should start this by saying I'm not a medical doctor. My background is in philosophy, and then I started to work in health informatics, which is a very broad field. But basically, what I recognized was most books on medicine were written by medical doctors, and that's good to some extent, but doctors don't have a vantage point in everything to do with medicine. So I could see that there was a lack of a sort of psychological portrait or description of what happened in medical encounters, the kind of pitfalls that can arise in communication, keeping up to date, challenge of empathy, all of these things that are psychological in nature. So my original idea was we actually need some sort of a book out there that looks at that kind of perspective. But then I realized you can't just write a book that's all about the negatives or the challenges. You need to offer some sort of solution. And this book was in the making for around 10 years. And gradually I was interested, what could the solutions be? Everyone's talking about technology. So it was of interest to me to say, well, look, can technology solve some of these very human problems in medicine? And that was really the that's sort of a synopsis of what the book's about. So I will say, although I look at the challenges, human challenges with healthcare, I'm not sort of saying technology's the absolute be all and end all. I'm saying it's not kind of a love letter to technology either. There's real challenges with the technology as well. But I do say this is the direction of travel, I think, in healthcare.
So more like another major tool in the tool belt to assist with the process?
I think so, but I also say that I think that we've got to remember technology is the worst it's ever going to be. And the point I also get across is an observation by a guy called a futurist, American futurist called Roy Amara, who said people tend to overestimate what technology can do in the short term, but underestimate what it can do in the long term. And that's very much a perspective that informs this book as well.
Yeah, kind of like my to-do list sometimes for a day versus a year.
Absolutely, yeah. And it's recognizing that those trends are continuing.
Yeah, exactly. Um, yeah, how did you, as you were writing it and researching, how did you think about balancing like the downsides or pessimism of the status quo, the situation in healthcare, with the optimistic side about AI's potential for positive future impacts.
Yeah, so I mean, I think one of the things when you mention the word technology, people are just either really, really optimistic, sort of take a really utopian perspective, or on the other hand, they're really dystopian and cynical and they say, they just don't want to hear about it. And I guess the tack I've tried to take in the book is to say, look, we've got to have a serious adult conversation about the middle ground here, because it's going to be messy. No innovations are they never solve one set of problems without inviting new ones. So my perspective is being to embrace the idea that, look, technology can be really helpful for some things and it's going to get better for some tasks, but it's not without its challenges either. And we've got to be serious about how we can work around those challenges, deal with them, and talk about them very loudly. So I acknowledge the fears. I also, to some extent, throw a wet cloth on the idea like it's going to be a cure-all. It won't be. There's going to be huge challenges ahead with it. But I do think there's a lot that technology can offer us, but we've got to be prepared to implement it ethically, safely, and all the rest.
Yeah. When you think about doctors and healthcare workers, what are the most common, like widespread issues that AI can assist with? Whether it's like diagnosis, I read an article about you, I think it was in August, about diagnosis, or whether it's treatment or communication or following up with patients. What what areas? Yeah.
Yeah, the big thing. So I've been doing surveys on doctors' perspectives. Like I've done them in America, I've done them global surveys, I've done them in the UK since around 2018. And I've asked them, I've sort of looked at different tasks that doctors perform. And I've said, look, which of these tasks do you think technology is going to be most helpful for? And when do you think technology is going to come to solve these tasks? And what's been really interesting is overwhelmingly they say technology will be helpful for documentation and administrative tasks. And those are the tasks that they are really burnt out with. The thing that they think it's least likely to come for is empathy. So they say that the human connection technology will never be able to replace. And then they tend to be somewhat in the middle, a lot of disagreement about whether it will come for diagnostics, to what extent, things like advice about treatment options. But the thing, as I say, the thing they're most hopeful about, and to some extent they're right so far, is it's documentation, it's admin, which doctors absolutely loathe. They're burnt out by it, and it takes over a huge part of their workflow.
Yeah, yeah. I mean, I was talking to some months back. I was talking to a friend of mine who's a cardiologist, and he was talking about this, like using AI to do the documentation after after seeing the patient, and how it's dramatically cutting down the time he's spending per week, per day, per week
Yeah.
on those notes, like, because he said he was just spending so much time.
Absolutely. And doctors tend to be working on negative time. So they have a certain amount of time per visit, and the time that it takes them to do the documentation. This is why doctors sometimes talk about date night with Epic, the electronic records vendor, because they're basically spending evenings or their weekends. And as one doctor, and I write about it in the book, says, let me tell you, if you're spending time in documentation well after a visit, it's not going to be very high quality. They're going to make mistakes. So this is where we're seeing new technologies called ambient AI that literally listens to the visit and converts that into documentation that starts to fill out the electronic health record. I recently did a survey on this in the UK, and sort of hot off the presses for you and your listeners. We asked 1,000 doctors in the UK. These were family physicians. 14% of them said that they were using ambient AI technology. Now, they didn't think it was perfect. They did, there's still errors in the listening and all the rest of it, but they did believe that the documentation was of a higher quality. And they said that it did reduce feelings of burnout and cognitive load. So it's making their life a bit easier. And that has to be a good thing. But I say not without errors. They do have to this is the challenge, they've got to pay attention to the mistakes and be careful. But we know that mistakes happen in notes. And when patients get access to their records, they see errors. And doctors know this. They know they're not always getting it right. So the technology could be a useful tool here.
Yeah, because a couple things, right? Like if I'm a doctor or you're a doctor and you're spending all that time taking the notes, right? There's a fatigue process taking place. So I would think as you get more fatigued, you're more likely to make more errors.
Absolutely. And in general, in healthcare, the more burnt out you're, like about 50% of doctors in America and in Britain are burnt out. They've got to multitask. They've got so much. About 20% are depressed in the States. The challenges on our doctors are huge. And the more burnt out you are, the more doctors who are depressed, they make more mistakes. I saw one study that physicians who are depressed are 6 times more likely to make medication errors. It's just really hard to stay on top of things. So whatever we can do to ease that burden is in the interests of patients as well.
And then looking at it from the patient perspective, I'm curious about, like, if I'm a patient going in, how can AI help me maybe prepare for the visit? So I'm asking appropriate questions to the medical professionals. Do you write about that or done research about that side as well?
Yeah, definitely. So that's included in the book as well. The internet, since the dawn of the internet, and I'm old enough to remember the dawn of the internet, nobody actually knew what it was really for at first. And they were like, what is this, But gradually people started to use it. And, of course, the phenomenon of Dr. Google became a thing. And that's still what people talk about. Doctors were a bit cynical about that. And so you have a whole load of, and I talk about this in the book, doctors were really skeptical. They thought patients are going to get cyberchondria, they're going to worry more, they won't know how to, cope with what they read online. Little education's a bad thing kind of mentality. But actually, patients have found lots of benefit from the internet. It's not to say that they can't be misinformed sometimes, but on the whole, it helps people to better understand. And we know that there's better and worse websites to check out information. With this newer range of AI tools, sort of generative AI tools, like ChatGPT and so on, we know that these tools can hallucinate, that is, they make these very compelling mistakes. But again, early studies show that patients are pretty savvy. They know that there's errors. They don't entirely trust these tools, but they do find them pretty useful. So you can have this kind of back and forth conversation with these tools. One interesting finding is that patients with rare diseases, they're twice as likely to use these tools already. And we don't yet have lots of survey data on patients because it's still very early days with these kinds of tools. But when I've surveyed doctors, they suspect patients are using these tools. And why wouldn't they? They use them themselves. So I think in general, they're going to be part of the toolkit for people. They'll look up about medication. They'll work out, should I go to the doctor? Are these symptoms serious? And they'll use it as a sort of a second opinion service as well. For doctors, they'll check what the doctor said. And in countries like the US, where you have access to your medical records, I suspect patients are probably, and this is where it can get worrying, probably cutting and pasting information into the record and saying, like, what does this mean? How should I think about this? So patients will use these tools, and it'll be a bit like an extension of the internet, even more capable of extracting our health information, unfortunately. But again, benefits and risks. Yeah.
Yeah, exactly. Particular domains that you found that AI already is excelling at or close to doing so, like you talked about primary care, or I think of like radiology or the mental health space, or like different areas that AI
That's
is.
a great question. It's in some sense, I think AI it's got scope in all of those areas. So it's really good at spotting patterns that humans can't see. One of the things I write about in the book is, so we've sort of been talking about human limitation, human burnout. Like our health systems, even in really wealthy countries, health systems are creaking. People are living longer. There's a shortage of doctors. People want information and help when they want it. The issue here is that these tools don't burn out. They don't need to take a break. I made a calculation. Take an example of keeping up to date with medical information. I think doctors of all human experts have the biggest knowledge demands placed on their shoulders. So I made this calculation a couple of years ago that I looked at PubMed, which is this sort of online repository, this library of biomedical articles. There's a new biomedical article published every 39 seconds. Now, if doctors were to read only 2% of those articles, the relevant ones every day, they'd be spending over 22 hours a day. And that's before they've even committed it to memory and being able to put it into practice. So the demands on doctors are really huge. And that's why when doctors have graduated medical school, their medical education tends to be more or less fixed for the rest of their career. So it's very hard to keep up to date. It's really hard to change how you practice, particularly when you're working in a job that is so frenetic and demanding as medicine. And this is where these tools can really start to shine, because they can keep up to date of medical information. And it's a matter then of saying, but I say they're not without errors, of course, not without challenges. But there's then this greater scope for, say, keeping things fresh, but also if there's omissions in the medical ed. So, for example, female biology is something that has been very extensively written about. Doctors not knowing enough. This is where AI could, if it's trained properly and more extensively, could start to fill things in a bit more. I'll give another example that I put in the book. Endometriosis. About 1 in 10 women in America has endometriosis. It's a very severe problem associated with period pain, but it's much more savage than that. It leads to all kinds of chronic ill health problems, and it's a very, very debilitating condition. But the average time for diagnosis in the States is 8.5 years to get that diagnosis, which is really, can you imagine what it's like in low and middle income countries as well? So you've got this real delay for something that's quite common. One study found that you could ask ChatGPT asking questions of endometriosis, it got 90% of the questions right. Now you can see then why people start to gravitate to these tools, because it may be picking up on things sooner. Again, they're not perfect, but if you've got a condition, you want to find out information, they can be highly useful. They can also if we want to contrast these tools with human doctors, again, which is, I think, is sometimes we should contrast them with human doctors, but also with the fact people sometimes don't get access to human doctors. So the right comparison is, not having any access to healthcare, and they can do away with some of that noise in healthcare. So time of day a doctor sees you can affect whether they screen you for cancer, prescribe antibiotics, whole host of things. The age of the doctor can affect their decisions, how far they've kept up to date. There's all kinds of noise in medicine, and these tools can eliminate some of that noise as well. So there really are opportunities here, so long as we don't get too complacent.
Yeah, exactly. I mean, I think of being a patient where the time I'm actually seeing the doctor is very limited because they got to go and see more patients. So that window to find out what's going on is very small, whereas all the time I'm at home is very large in comparison. So being able to use the internet, use AI to understand, like you were talking about earlier, understand my situation better can be highly advantageous prior to and then following up after that little time window I'm with the doctor or doctors.
That's it. In wealthy countries, patients see their doctor for an average of 30 minutes a year now, which isn't a lot. Whereas if you have, even you take this smartphone here, this thing is with us all the time. It knows a lot about us. It knows, how sociable we are. It knows how many steps we take. It knows how much time we spend in a pub. It knows, sedentary we are. There's loads of ways in which technology has that kind of continuous monitoring of our behavior. So that's another aspect of this whole thing. In America, it was a fascinating, it was a Pew survey, I think a couple of years ago, which found adult Americans spend about, on average, 5 hours on their smartphones every day, which is very scary. And for some teenagers, it's like they're on these things almost constantly. So the aspect of this is technology already it's so embedded in our lives. It's a repository of information about us. So, and I've already forgotten the original question because I was thinking about this kind of continuity of, remind me what it was.
Yeah, I was just saying, like, that time you're with your
The
doctor
time,
for that
absolutely.
small
Yes.
window, and the majority, over 90% of the time, obviously, like, wait, maybe 99% of the time, you're not with the medical professionals. So you can be like, okay, it's almost like a little bit of a doctor in your pocket
Yeah.
to finding out some process of understanding at the next level of
Yeah.
what can I do about this?
That's it. I mean, when we're in the medical visit as well, one of the things I talk about early on in the book is there is this sort of status difference built into the visit. So the reason you go to the doctor is they're an expert. But in fact, this is where the human side of healthcare can sometimes be a limitation, because if you look at the psychology of status and prestige, because doctors are sort of comparatively prestigious people. I mean, that's the reason you go to visit them. They have this particular expertise. That tends to exert a kind of silencing effect on us. So not only is it the pressure of the time, like, oh my God, I don't want to bother my doctor unless it's really serious, and people delay for that reason. But actually in the visit, people don't want to talk too much about embarrassing symptoms. They don't want their doctor to judge them. They don't like to ask too many questions because they don't want the doctor to think they're stupid. Like, we have this survey information. 85% of Americans say that they've lied to the doctor or sort of massaged the truth with the doctor. What's the leading reason? Embarrassment, judgment. In contrast, people tend to pour their hearts out to machines. And that's it. That's a problem too. But we know that when you're in front of a computer or an electronic device, and we've known this for many decades, by the way, people say more. They don't care. I mean, like, you can't be interrupted. Doctors do interrupt patients because they're conscious of time, but they also, because they tend to dominate the conversation, they interrupt, and that can sometimes throw patients off so that they don't talk about the second or third symptom that they came in to discuss, or they forget about it. So the visit communications really pressurized, not only for the constraints on time, which, as you say, people have more time at home, they can look things up at their own leisure, but there's also this kind of interview visit mentality where they become more intimidated. And that's something of a kind of this is why it's, I think, important also to have people who aren't medical doctors commenting on medicine and discussing medicine, because I think that's a kind of blind spot. There's no reason why doctors would really think about that. But if you come at it from a more psychological perspective, that's a very sort of straightforward finding that you would expect to find that in the visit. And this is, again, where technology could function as a workaround.
Yeah. And is AI being used in training in medical school to assist with this, or something they're starting to consider, or where is that in the equation?
In general, what's happening, you got pockets of activity in elite medical schools, but in general, Chad, it's really disappointing because actually medical education has sort of stuck its head in its stethoscope in the sand about this. There's still a tendency to train doctors in very 20th century ways. So it's still like Krebs cycle, biomedical education. It's still, probably most doctors would recognize today in the medical education, their fathers. And by the way, medicine tends to be a very inherited profession, I should say. So it runs in families. That's a whole other set of issues. So the training is really, it needs to become more 21st century updated. People need to be able to understand technology. And this is one of the points I make in the book. And actually, Eric Topol, who's has written a lot about AI. He wrote a report for the British government, for the NHS in the UK, so it's the National Health Service, about the need in Britain to keep up to date. And unfortunately, there's still a lack of, this was 2019, he wrote this report. There's still a tendency not to educate doctors. I did a survey very recently. I did it in Ireland, of all countries. I'm Irish, but looked at final year medical students. Now, Ireland's a very highly educated country. You've got more people doing university degrees than anywhere else in the EU. It's a big tech hub country in Europe. Final year medical students, most had, it was actually 2/3 of final year medical students had zero education on AI in their entire medical degree. And something like 85% had 1 hour, so they probably went to listen to a guest lecture or something. So there's real issues in not medical curricula not adapting. That's a challenge, because even though the technology keeps changing, people need to learn how to adapt to that change. They need to be able to be facile with recurrent debates when it comes to AI. And unfortunately, partly I think because medical education is still a bit of an apprenticeship. So you still learn from your higher ups, you go on the job, you're kind of copying, a large part of it's mimicry on the job. But there's just not this training, and I think that's such a mistake.
Yeah, I mean, that seems like a massive gap, right? If I'm going in and doing my end of medical school, third, fourth year, then residency from someone who has zero or very little experience and expertise with AI and using it, I'm just moving that along, that education, and almost in the wrong direction, or a pathway that's not going to further my abilities to my own education to use this technology for a benefit.
Yeah, and I still think there's a lack of leadership in medical education on this. The other side of this is that younger people tend to be faster adopters of technology. So then you've got this thing where younger physicians are probably using these tools. We've done surveys on generative AI, for example. I'll give you a taster. I've done surveys in the US. I did one of the first surveys of American psychiatrists with a colleague at Harvard, and we asked them, it was a very, very small sample size, about 140 psychiatrists, but about a third said they were using ChatGPT to assist with clinical tasks. But 2024, again, I surveyed British general practitioners, and 20% said they were using tools like ChatGPT to assist with any kind of clinical task. I did it again with my colleagues in 2020. We found 25% said they were using these tools. Now, one of the big, those are staggering figures. But one of the big findings was they didn't know when they should be using these tools. They weren't sure, am I allowed to use these tools? To what extent can I use them? And there was a real hunger for training. Wherever we've done these surveys, doctors are just not clear, and they want to be trained. They even just want very targeted training. And there's just tends to be this time lag in medicine where there has been a failure to offer guidance. Now, I have great sympathy for doctors on that, and because they're doing their best, but they are availing of these tools.
Yeah, and I mean, it sounds like what you're describing is like it's more on a individual than an organizational or systematic approach. Like, you might be going, okay, I'm going to use it, or I'm going to try it like this, and I might be going, okay, as a doctor, I'm going to try it like that. But how do you know if you're getting maximum benefit out of it?
Yeah, that's a great question, particularly with those sorts of, as I say, generative AI tools. I mean, there's been some very interesting experimental studies that have found that actually when doctors use these tools, they tend to hurt the accuracy of the tool, which is really an interesting finding. But in some ways, the tools on their own are more diagnostically accurate. So you've got also this interesting body of research that again has tended to be siloed and tended to be ignored by healthcare, which is looking at how people respond to algorithmic output. And a general tendency is lay people tend to be more trusting of algorithmic output. It's what psychologists call algorithmic appreciation. On the other hand, any sort of domain expert who, in a particular field, tends to sort of hold their nose a bit more to the algorithm because they're trained in a particular way. They tend to be more confident. And there's a sort of squaring up there, possibly between the algorithm and the expert, but they tend to sort of dismiss the outputs a bit more, and that's called algorithmic aversion. So then there's this issue, like if the technology and the algorithmic output gets to be quite accurate, how then do you pair the human to ensure in a justifiable way that they're interrogating it correctly without being averse to what it's saying? So it's getting this sweet spot between the human whereby they're not hurting the accuracy, but they're also not necessarily overly trusting of it either. That's going to be an ongoing challenge. I have a couple of chapters in the book about that. But there may be a time as well, which it will be very unnerving to people when the technology just is better. And it's probably better to leave the technology to give the output because it may be more accurate on average, which probably is making many people feel queasy already. But those are important conversations that I think we need to have.
How does that process work, finding that sweet spot you talk about? Or
Yeah,
how do you see it?
yeah. I think it's a large part to do with how we train people. If you are trained in a particular way, so how we're currently training medical experts, they're the expert. And the way a doctor thinks about when you enter medical school, you're training to become this kind of one-man band. I'm the expert, I'm the diagnostician, I do it all kind of thing. So the key challenge might be in terms of this sweet spot, it's thinking about this psychological relationship, how the human responds to the AI. So it could be that, and again, we need more experimental studies on this, but is there a particular type of training that suits interrogating the AI better? It may be that you have a certain amount of medical training, but you're not considering yourself as you have a sort of complete knowledge in a field. And that might be the way to get the best relationship between the tool and the human as a different kind of clinician. So that might be one way to think about it. But what I do think in general is we need to think more about the psychology between who it is that's serving and delivering care or working behind the scenes and the technology. It's often called the last mile problem in healthcare. So you can devise all these fancy tools, but how you get them actually integrated is sort of like you can't just throw them at clinicians. They have to be well thought out, they have to be designed. And we also have to think about who is the expert, because people will respond in particular ways, particularly if they think their expertise is being challenged or there's a sort of existential crisis or identity crisis here with is this technology taking over my job, as opposed to I can partner with it in a way that could be successful.
Yeah, exactly. So it's like, to me, it speaks to the ego, like creating an environment where the doctor, the medical professional, the expert feels like, okay, I'm working together here with the technology to create better health outcomes, rather than this is just, well, I've done all this education, I've done all this work, and it's just completely diminishing my
Yeah.
capabilities and capacities.
Yeah, and you do see in survey research and so on, even anecdotally, doctors can bristle like anybody would. You've spent a decade of your life educating yourself in a particular way. In the States, you might spend at least $250,000 in medical education. That's after you've got an undergraduate degree and you've invested all this time and energy and then this tool. So there is this tendency then to say, there has to be a role here, and it is an existential threat. And I think in general, it's not just thinking about the medical profession. We can see it across a whole variety of roles and jobs and occupations where there is a threat. And that's another wider conversation that we need to have about technology, because some of these tasks that are being taken over, or that AI can do quite well and is beginning to do quite well, sometimes with human oversight, but other times I mean, it may begin to take over. I talk about that. We need to have a broader societal conversation about are we happy with jobs being taken over by technology, and what happens to inequality? How do we want to run society? How do we recompense people when the jobs are taken away by technology? Those are huge issues that in some sense I don't think we should delay. They're political issues as well, and we need to, as a society, decide what is it we want to get from technology. So it's not just for the medical profession, I think.
Right, it's across the scope.
Definitely. Yeah.
Do you think we're A, having those conversations right now, or B, having the right conversations about it? How do you think
I think we're not having enough of the conversations, and I think sometimes the conversation does become too black and white. And this is where we do need to have this real world conversation about the opportunities, because there are opportunities here too, but we also have to decide, what happens when these big tech, do we want, for example, Amazon or OpenAI or Meta to run our health system? Because, who do we want to be responsible for our private health data? Those are very pressing questions that we need to have right now, because patients are using these tools, and they're going to, I don't think we're yet at that tipping point, but they're only going to increasingly use these tools. They will be able to have access to our most sensitive health information. It may be complicating matters further. They may be extremely useful tools. Doctors, as we've seen, are using these tools as well. So you've got all of these messy challenges, and we need to have a very honest conversation about what happens. If privacy's gone, then what happens to confidentiality? What happens to the exploitation of our health data? How is it sold for profit, leading to a whole cascade of other challenges that lead to greater inequality in society? So I don't think we can delay those conversations, and which is why this kind of podcast discussion right now is really useful, that people can start thinking about it, because they're not tomorrow's questions, they're really today's question.
Yeah, exactly. Getting people to think about, like you were talking about, not just the black or white, like yes or no, but like everything inside of, okay, this is here and this is going in this direction. And how do we want to be interacting with this, not just in the medical space and in our healthcare, but in every aspect of our lives and society?
Yeah, I think that's right. And especially with young people, to say, who, if they have access to a digital device, and we've seen, a lot of reports, particularly using chatbots as forms of counseling or therapy or advice. And there needs to be greater guidance. There needs to be greater guardrails. But we got to be realistic. People are using these. So, I mean, it's not a case of just banning them. I think that would be a mistake. We've got to have a realistic conversation again about guardrails and holding organizations, big tech, to account as well, and just more awareness in the public. For parents, teachers, young people need guidance about this as well. So it's not just, medical doctors or whatever. I think this is where we can think about healthcare and well-being. We need greater understanding. We've got to have those conversations.
Yeah, exactly. Yeah, developing, like you said, better understanding, better education about implications, consequences downstream, how this is affecting our lives, our youth going forward, what might be the ramifications 5-10 years down the road and beyond. Starting to have those conversations opens up, I would think, like other questions, versus not having those conversations. It's like that door is closed and we don't even think about the possibilities of positives and negatives and nuances of it.
Yeah. And it is important to capture the nuances here as well. I mean, kind of going back, and this is why it's complicated. This is just so complicated. We should be wary of, we've got to consider sort of the benefits, but also the risks. And I go back. So if you look at the history of medicine, and sort of panning out and saying, look, history of medicine has been a case where often innovations have been sort of postponed. So if you consider, like, most medical innovations, doctors were very defensive and resistant to. So anesthesia, antiseptics, clinical trials, penicillin, even hand washing. Doctors were resistant to the need for this. These tools as well could offer lots and lots of opportunities. So again, it's having that very difficult conversation within that kind of grey middle ground. The ambiguities here can be difficult, but at the same time, there could be key benefits. Bias is another one. So we talk, there's a lot of discrimination in society. There's a lot of problems with access for a lot of different demographic groups. There's a thing called the inverse health care law, which is this observation that the people who are most in need of health, elderly people, people with disabilities, people with low incomes who suffer from greater health problems, more susceptibility to chronic health problems, they have the greater challenges in getting access to care. So you've got issues there where technology could be useful, giving vaster numbers of people greater access, but then you've got all these other challenges too. Digital divide, who has access to these tools, do they have data poverty, do they know how to use these tools, what are the environmental trade-offs of using these tools, and then the global ramifications of, so it's all connected. And I don't think there's going to be any easy be very wary, I think, of anyone who's offering easy cut and dried solutions to any of these things. They're going to demand very loud dialogue and difficult conversation.
Yeah, working through versus just like, okay, this is it. This is how you do it. It feels like it sounds like it's going to be an experimentation, a process of like trial and error of when you talk about people that haven't had as much access to this information and education, and a learning process over time, and also a greater conversation about how do we best use this.
Definitely the latter. But also, I think, as you're saying, people will be using these tools, especially if they don't have ready access to healthcare. We can see this even in some early studies in the States, where if you look, some studies, I think it was the Kaiser Family Foundation did studies which found that African Americans and Hispanic patients who were surveyed were more, we need more of these surveys, but they were more likely to see benefits of accessing generative AI tools for health information, and they were more likely to trust it. Now, whether they were, it's right to trust it is another question, but the issue then becomes against what? Because if you have greater barriers to healthcare, you may be voting with your feet and you availing of these tools. Another interesting sort of statistic is the amount of time people take out of their day to go to a medical appointment. The American Time survey data, this was a couple of years ago, found the average American takes about 2 hours out of their day to go to a 20-minute medical visit. And that figure is like 28% higher if you don't have a job or you're on a low income, because you have more public transportation needs, more challenges. You might have a gig economy job. It takes more time out of your day to organize yourself. Logistically, it's a bigger challenge. And again, this is where you may get certain demographics more likely to use these tools. And then are they at greater vulnerability through using these tools, higher risk of exploitation? These are all the challenges. I think on balance, people will derive a lot of benefits from these tools. But again, we've got to be really careful about whether whether on balance they are getting more accurate information, and avoiding seeing doctors who are using them as a sort of supplement or replacement.
Yeah, exactly. Are there ways that the technology AI could potentially exacerbate the health inequities of racial, socioeconomic, language?
Yeah, I think there's lots of opportunities that it could exacerbate inequalities here. Again, one simple one is, but it's going to be complicated. It's not going to be, so for example, who has access to digital tools? Who can use them? There's always demographic differences there. Who has broadband access to the internet? Across the world, something like 57% of the world's population now has an internet-enabled cell phone. We do, more people have access, but they aren't necessarily able to use these tools, which are very demanding of data. So if you've got data poverty, you might spend less time online or be able to use these tools. So that's an opportunity for a digital divide, even if they do offer access and greater health information. There's also the issue of when you're actually online and the advice that's given by the algorithm. For example, again, to look at generative AI tools like ChatGPT, most of their training is open source information on the internet. Half the internet's in English, but only like 1 in 5 people across the world speaks English. So you have this sort of underrepresentation with certain languages. That's getting better with some of these tools, I should say, but there will be issues where both culturally, linguistically, there could be more marginalization among already marginalized populations. And then you have the issue of the diagnostic accuracy if you're looking for health information. So how these tools are trained, if they're trained on information that's out there that's not well curated and they're not trained well, they perpetuate biases. And the same omissions and biases that even our medical doctors may be trained on could be perpetuated, even exacerbated through these tools. So this is where we have to think, we've got to be really careful about how we're training these, what data is being fed into them. There are chances here to do things differently. So that's why we also have to talk about the opportunities. One of the things I say in the book is we rightly have conversations about discrimination through technology, but a large part of the focus is criticizing what technology can do. And I want to say that if we have an ethical conversation here, it's also unethical to consider to delay progress where there could be progress. So you could sort of talk about sins of omission, sins of commission. If you're not actually constructively having conversations or thinking about ways that these tools could be better constructed, then you're missing a big opportunity too. It can't all be focusing on the negative. You've got to think what we can do better. And there certainly are opportunities. And as I say, I write about them extensively. But one of the thoughts that I have here too is if you're trying to de-bias medicine and you're trying to avoid stereotyping that can kick in medical visits, which does happen, and it's a source of error and communication breakdowns. One of the issues is it might actually be, and people may be bristling or feel queasy about this, what I'm about to say, but it might be easier to de-bias some of these tools than it is to de-bias doctors. It's very hard for people to manage their own prejudices and to be very introspective about what it is they're doing in a medical visit. Always easier to spot the bias in other people, and it's the same with technology. So we could harness that particular psychological peccadillo to say there could be opportunities here, but only if we avail of them.
Yeah, that's such a good point, Charlotte, is how do we admit and recognize our own biases and then think about this is a learning tool, this is a learning system that we can continue to train and improve that helps us in all capacities. Makes me think of this, the quote of, you don't rise to expectations, you fall to the level of your training.
Yeah.
So it's like, okay, if we can continue to improve the training from a learning standpoint, then we can improve outcomes, health and otherwise.
Yeah, I think so. And I think one of the things we have to be really careful about here too is not holding the technology to a higher account than humans. And that's something that we find people do tend to do. They tend to be more forgiving when humans make mistakes. It might be in some contexts that's okay, but in other contexts that might not really be a suitable sort of psychological tendency. It may be that we're better being more equitable towards what the AI can offer us, particularly when it comes to clinical accuracy. So we've got to be careful about that too. But I do think greater awareness of the job opportunities within AI and technology as well, but also how we ethically harness these tools and what they're always asking what they're for and what they're good for and what their consequences may be are key questions. So it shouldn't all be the focus on the gee whizzery of the technology. Always ask what they're for and what they can do for good or for ill.
Yeah, exactly. Charlotte, this is Absolutely fascinating. I could spend all day or all week or all month asking you questions and
No, it's
learning
been
more
fun.
because what's that?
It's been a lot of fun, yeah. It's
Yeah,
a big
right.
topic, yeah.
Yes, it is. And the way you speak about it, the nuance, and it gets me thinking about, okay, in other ways, right? Like not just in healthcare, but it's like, okay, how can I interact with AI and technology to benefit my life and benefit others? So it has an expansive feeling to me, like rather than
Yeah.
like a restrictive or constrictive
Yeah.
feeling.
Yeah, and I think we've got to continue to think of it as a tool that we can control. And I do worry that we're already feeling like it's out of our control. There's nothing we can do, um, both in terms of the people and the companies who design these tools. We shouldn't lose sight of the fact that we can and should hold these big tech accountable. And if we feel like our politicians aren't talking about these issues, it's up to us to press them on it as well, because it's the biggest question I think of our age, and I think it would be unforgivable to delay these kinds of questions. So we've all got to get involved and not be afraid of what we don't know, but just continue to ask questions about these tools, and we shouldn't fear them. They can do a lot for us, but as I say, they're not without their own challenges. Life's never simple.
No, no, it's not. That's like that's a good wisdom comment right there, statement quote.
Yeah, good way to end, maybe.
Yeah. So, in closing, where can people find your book, follow you in your work? Any closing comments, thoughts as we're wrapping up?
So you can find my book. It's called Doctor Bot: Why Doctors Can Fail Us and How AI Could Save Lives. It's available on Amazon and all the usual good bookshops. And I'm on LinkedIn and on Twitter at CR Blease. And I do a Substack every week. It's Blease, please with a B, as I've been saying my whole life. On Doctor. I think for closing wisdom, I would say the reason I wrote this book was to ask the question. The purpose of medicine is the care of the patient. So the key question then is who or what can do a better job of delivering that. So my key concern has been to say, let's be really neutral about this. Let's think, where is technology beneficial? My own perspective, the whole book is written full of patient stories, patient perspectives, and my perspective is the care of the patient. So it's keeping an open mind about where technology can be beneficial, but also being really candid. Doctors, we tend to think doctors are gods. They're not. So let's take seriously the fact they are only human, and we put a lot of pressure on them. And there might be better ways to deliver healthcare. So that's the perspective I'm coming from.
I love that perspective and appreciate that perspective so highly. Thank you, Charlotte.
Thank you, Chad. This was fun.
This was. All right, stop here. This is frozen. One sec. Oh, there we go. Thank you for listening to this episode. I hope you enjoyed it. Subscribe wherever you get your podcasts, and if you liked it, please share with a friend on social media. That goes a long way to promoting this podcast so I can continue to interview and share these conversations with fascinating people. You can follow me on social media, Chad Stoloff, and visit my website, chadstoloff.wordpress.com, for more information. I'd love it if you would leave a review to support the podcast. Thanks so much. Until next time.